Hi, this is Christopher Hobbs, and I'm going to talk about mushroom spirit medicine. Also, you might say visionary mushrooms or hallucinogenic mushrooms like psilocybin. Here's a little bit about me. And here you're seeing a variety of psychoactive mushrooms, namely psilocybin and Amanita muscaria. Here you see a phylogeny, a kind of a family tree, if you will, showing the universal ancestor. There's your pointer. Universal ancestor here, and which was, perhaps cyanobacteria, and then you're seeing other lineages coming off of the main tree of life here. Archaebacteria, protista, one-celled organism, could be multicellular, but very simple organisms. And then the plants, and then fungi, and then animals. So the phylogeny here, the family tree, shows that fungi are actually more closely related to animals, namely us, than they are to plants, even though the kingdom or fungi used to be placed in the plant family. Oh, and I forgot to say that there are an estimated 5 million species on Earth. Of course, there are a number of pathogens like Candida, and there are a lot of beneficial species as well. Now, mushrooms as functional foods. There are pathogenic fungi out there, it's true, but there are also a lot of beneficial species as well. And when you consider higher fungi, fleshy fungi that produce fruiting bodies that are very observable, like, for instance, porcini or agaric's button mushroom and so forth, then the popularity is high all over the world. The button mushroom, Agaricus bisporus, is the #1 most commonly produced commercial fungi, next shiitake. But there are also a lot of other mushrooms which are used for medicine around the world and have been for many, many centuries. The most popular of these are shiitake, maitake, reishi, cordyceps, turkey tails, lion's mane, chaga, Agaricus blazei, which looks kind of like a button mushroom. And I can say that in North America anyway, in other countries, you can sell mushroom extracts of the fruiting body or mycelium on the dietary supplement market without registration. And it's pretty open to, for instance, extract turkey tail or reishi and sell them as a medicine, as a dietary supplement. There are many different types of products available around the world, like especially in China, where they use liquids and elixirs and so forth. In our country, in the United States, typically mushroom mycelium powder is sold. The mycelium of reishi or turkey tails, lion's mane, other species are grown on rice. They're cultivated on rice and then harvested and steamed or heated to break down different cell wall structures so that we can access or absorb the active constituents. And then those are usually dried and powdered and placed in capsules. So capsules are very, very common. You can also buy bags, different size bags, like 100 grams or even a pound or whatever of mycelium powder. Some companies sell fruiting body powders, but this is not the most common. The most common products out there are typically mycelium grown on rice or other substrates, other nutritive substrates. The reason for this is because they're a lot cheaper to produce. It's very expensive to produce fruiting body fruiting bodies and products, it takes much longer for the fungi to produce the fruiting bodies. You don't get as much biomass as just harvesting the mycelium, which are white threads that grow and consume the nutrients of cooked rice or other substrates, perhaps wood. And so they're just much cheaper to produce. And so that's why you mostly find those on the market, and also faster. Yes, and the last point here that I want to make on this slide is that psilocybin or hallucinogenic mushrooms can also be used for medicine. There are clinical studies on them for depression and addiction and other purposes. And these are just starting to be decriminalized in just a few cities, in Oakland and in Denver. Okay, some of the health benefits of mushrooms. They have very little fat and no cholesterol. They have a lot of minerals in them, such as potassium, iron. They're a very good source of some minerals, not calcium, pretty low in calcium. They're very high in B vitamins. Oyster mushrooms or Pleurotus provides a better supply of B vitamins than any common food except meat. Of course, they're a great slimming food because they have so much fiber in them and because they are low fat. They can regulate cholesterol, such as if you're eating shiitake or oyster mushroom frequently, then that can lower your cholesterol. And again, they're very, very high in fiber, one of the highest foods in fiber. Here's a funny slide. This pointer back on. Here you're seeing a gelatin brain. This is a mushroom conference that I go every year to speak in Santa Cruz. And this is a gelatin brain that someone brought in. Simultaneously, somebody brought in some psilocybin mushrooms. Here's one right here with the wavy brown cap. That's probably Psilocybe cyanescens. And so I thought, oh, this is fun. This is fun. The penicillium mold started growing on the gelatin brain that turned purple, had purple spots like this. So I wrote out these notes. This is psilocybe. This is your brain on psilocybe. Any questions? So just a kind of a fun display that we had in one of the mushroom fairs. Hopefully this isn't really what happens to our brain when we ingest psilocybe. Now, Michael Pollan wrote a book recently called How to Change Your Mind, and these are the points that he made in his book. How to change your mind. In other words, using hallucinogenic substances for medicine or for change. Here are his points. Ingestion of psilocybin species and other psychedelic substances can temporarily dissolve the sometimes tyrannical or trickster ego. This allows time and space to see one's plight, symptoms, diseases subjectively and realize we don't have to identify with them. Or it also allows us to find peace and equanimity with serious illness like cancer, intractable symptoms. It allows us with higher doses to connect with a sense of oneness with spirit or God, to feel a sense of awe. Many report this with higher doses, to feel profound feelings of connectedness and a lack of separateness, loneliness, or isolation. Now, interestingly, since the 1960s, when research started on psychedelic drugs, remember that Albert Hofmann discovered LSD or created LSD in the 40s. And the first reports of the use of psilocybin mushrooms by indigenous cultures down in Mexico, southern Mexico, were noted in the 50s. So about the mid-50s. So by the 60s, there was a lot of research and interest in psychedelics, mostly underground. But then, and a lot of published studies, more than meets the eye, really out there. They weren't high quality studies, but they were studies on addiction and other things, smoking cessation, and a lot of them were published. However, by the 1970s, here's my classic reading list. So if you're interested in reading more about the use of entheogens or hallucinogenic mushrooms for health and healing, then take a look at some of these. Soma by Gordon Lawson talks about Amanita muscaria, hallucinogenic mushrooms of North America, Ott and Bigwood. Psilocybin Mushrooms of the World, Paul Stamets, How to Change Your Mind. I mentioned Michael Pollan, that's a current book that really goes over all the characters and history of psychedelics, and a very good read. Sacred Mushrooms of Visions, Ralph Messner, Food of the Gods, Terence McKenna, well-known book. Plants of the Gods by Richard Schultes, who was the world's most famous ethnobotanist from Harvard. Albert Hofmann, the discoverer of or creator of LSD. And so check these books out if you're interested in more reading. Now, this slide shows that on January 9, 2019, Denver, the city council voted to decriminalize psilocybin. In other words, to make it as the lowest law enforcement priority. It didn't legalize it, but it said that people have the right to use it within the city limits. Don't ask, don't tell is kind of the idea. And so if you don't flaunt it and they just happen to find mushrooms on you, they're not going to pay much attention to it within the city. Also recently, Oakland, California went ahead and did the same. Maybe the first step towards legalizing state by state for medicinal purposes, just similar to cannabis. Now, the pronunciation of psilocybin mushrooms, it's actually psilocybe, according to the proper Latin, psilocybe or psilocybe, or so we usually say psilocybin or psilocybe. But, you know, who really cares about the pronunciation that much? So this is just for if you're a stickler for, okay, I have to pronounce it right, but which not many people are really. Now, a number of genera, plant or mushroom groups besides psilocybin or psilocybe contain the active hallucinogenic substances which were determined by Albert Hofmann to be psilocybin and psilocin and baeocystin. So these are the active compounds that act on our serotonin receptors, and it turns out that, of course, the genus Psilocybe, the psilocybin mushrooms, a lot of them do contain high amounts of these active compounds. However, there are other groups of mushrooms that also produce them, interestingly enough. Why are they producing them? Is it animals are trying to eat them like a squirrel and then getting the squirrel stone? So I don't know if I've ever seen a squirrel on hallucinogenic mushrooms. It might be quite interesting, but I don't think I'd want to be too close to them. So these are Stropharia, the genus Stropharia, Gymnopolis, Paniolus, Conocybe, Inocybe, and Pluteus. So these are some of the other genera that also produce these hallucinogenic compounds. Ganoderma produces other active compounds, but it is not per se not a hallucinogenic. It was considered a spirit mushroom, though, for healing the spirit. Amanita muscaria does have hallucinogenic compounds in it, but not psilocybin and psilocin. Here is a chart showing how much psilocybin and psilocin is in hallucinogenic mushrooms. So you're seeing you're seeing Psilocybe azurescens contains the highest amount of psilocin and psilocybin than any species of mushrooms. And that is over 2% of these active compounds. Then Psilocybe bohemica is very, very potent. Psilocybe SemiLancia, almost 1%, so that's what, or maybe more. That's what we used to pick on the Oregon coast. And cyanescens is considered a very potent species. That's over 1% when you combine both of the active isomers. And Psilocybe cubensis is the most commonly cultivated species, and that contains lower amounts, but still certainly quite enough so that you can feel the effects. Then we have other species, as I mentioned. Gymnopolis contains only about, when you consider both of them, only about 0.6% or so. Inocybe, 0.4%. Copelandia cyanescens, 0.3%. Pinealis, 0.4% about. Canocybe, almost 0.9%, so that's a very potent species. And Pluteus salicinus, about 1%. Now keep in mind that some of these genera, like Inocybe and Canocybe, have some very toxic members that look very similar to the hallucinogenic species. So you have to be careful with those. Now the standard doses of psilocybin. The medium oral dose is considered to be about 7 milligrams of psilocybin plus psilocin, and which you might find in about 1 gram of dried Psilocybe cubensis, less for more potent species like cyanescens or azurescens. The toxicity of psilocybin is very low, especially when compared to its effective dose for humans, which is only 0.02 milligrams per kilogram. And you can see that for a mouse model anyway, it takes 280 milligrams per kilogram of the active compounds to really start getting in the area where you might say it's causing toxic effects. So that is a massive difference between what is active and what is toxic. The recommended maximum dose under most circumstances is 150 milligram of psilocybin, which is about maybe a little bit less than 10 grams of dried mushrooms. So that's a very large dose, and that dose is typically associated with bright colored visions when you have your eyes closed that are ever changing, and also with higher states of consciousness and connection and experiencing very, very profound spiritual experiences. There's a structural similarity of psilocybin and psilocin to serotonin. That's why it's active in the brain, because it is binding to serotonin binding sites, and perhaps others. Psilocybin is still detectable in the blood after 7 days, so that's pretty significant, though it's not after 6 hours, 8 hours. You probably won't feel many effects of the as a hallucinogen. You would recover mostly and not have a lot of side effects or after effects after 8 hours or so. However, it's still in your blood and it still might be having some types of an effect. Quality is very important. If you know what a psilocybin, or how to identify a psilocybin mushroom, which I'm going to talk about later, then you can collect your own in certain areas, like on bark chips in public places sometimes. They've been found. So, or you can actually buy spores off of the web because the spores don't contain any psilocybin in them, so they are legal to sell. So you could, if you knew how to do it, you could have a sterile environment like a box or something with gloves, and you could sterilize the inside of your box, put your hands in the gloves, and then you could grow or germinate the spores on nutritive substance in a test tube, and then make petri dishes of agar, which is another nutritive substance, and then in the glove box, you could take a little hoop of wire, and you could take the germinated spores, the mycelium, out of the test tube, and you can streak it into a petri dish and start growing it out on a petri dish. And you can get more mycelium, and then you can break up the agar and put that into wood chips, sterilized wood chips, and actually grow psilocybin mushrooms and fruit them after some time. Okay, let's talk about the physiological effects that you might expect after eating psilocybin mushrooms. First of all, you will get increased body temperature, pupil dilation, hair erection, pleasant or in some cases apprehensive mood, spontaneous laughter, muscle weakness, drowsiness, and with higher doses, spontaneous colored visions, a dreamlike state. And if you feel apprehension, recovery is typically from, you get over that apprehension or uneasy feelings, you get over that in between 2 and 6 hours. And very low acute and apparently chronic toxicity. Now, you may or may not experience all of these signs and symptoms. You may not get drowsy, you may not feel muscle weakness, you may not start laughing uncontrollably, but some people do. So these are just kind of a menu of some things that you might experience. However, if you take enough, you're more than likely going to experience spontaneous colored visions. It has some study, like in Amsterdam, showed that it has the lowest dependence of potential of any recreational drug or therapeutic drug likely. Some risks exist for individuals that are taking other types of medications, medications like antidepressants or SSRIs, other type of drugs that affect your psychology, then it could interact. So better off not to be taking concomitant pharmaceutical drugs. Now let's go into the history of psilocybin use a bit. Consumption was confirmed in ritual ceremony, which may go back about 3,500 years. And here are the references. We know that there was widespread use throughout Mesoamerican cultures, including into southern Mexico and Central America, the Aztecs. There are murals, for instance, at 500 Common Era, showing fungi that they were probably psychedelic. First written reports from people coming from other places were from monks from Spain, typically, later Spanish soldiers and historians. So there are some Spanish historians that came from Spain in the 1500s and described their use of the Aztecs, Incas' use of psilocybin mushrooms in detail. The mushrooms were eaten with honey and typically along with chocolate. They don't really taste that great, so I can understand why they were eaten with chocolate. Well, they considered chocolate sacred as well, which many people today, I'm sure, do consider chocolate sacred, especially if you're used to eating it frequently. So psilocybin, called Teonanacatl, were eaten for their prophetic visions, and priests used them and warriors and healers also used them. So they were widely used by certain classes of people, especially shaman or priests would use them to divine the disease of their patients, and also to give them intuition, to open up their, connect them with spirit and open up and their intuition so that they could intuit the disease of their patients and the remedies. By the way, this is still performed in southern Mexico in some places, and also in Siberia with Amanita muscaria. There are still shamans that are using hallucinogenic mushrooms for shamanistic purposes today. There are also many mushroom stones which were carved. You're seeing a series of mushroom stones over here. Over 400 religious mushroom stones have been found in Mayan excavations. Now, the first Westerners or outsiders to discover and look into the use of hallucinogenic substances were Gene Johnson in 1939 was the first outsider to observe the shamanistic use of psilocybin mushrooms in southern Mexico. Blas Pablo Rico, Richard Schultes, again mentioned, is the very well-known ethnobotanist at Harvard, 1938. And at that time, he collected 3 samples of sacred mushrooms, which he deposited in the Harvard herbarium. But he didn't know what they were. He wasn't a fungi taxonomist. So late in the 1940s, Rolf Singer was a German mycologist, and he looked at these specimens and concluded that they were from the genus Psilocybin. And later Gaston Guzman, who is still alive, he's considered the world's leading authority on psilocybin mushrooms. And he identified one of the mushrooms in that first collection by Richard Schultes as Psilocybe caryolescens. And that's when it really started in a more developed world and country, the United States and Europe. The true scope and identity of shamanistic use of psilocybin, which has been going on for centuries, perhaps millennia, was finally uncovered by Gordon and Valentina Lawson. And first in 1952, they went down and visited Marina Sabina, who was a mushroom Christian shaman, and visited her hut in southern Mexico, and were the first outsiders to imbibe psilocybin mushrooms. And it was then reported in Life magazine. Here is Maria Sabina, and again, the article was published in Life magazine in the 1950s, seeking the sacred mushroom. And here is the hut where Maria Sabina lived and practiced, and the others. Here's Gordon Wasson and his wife Valentina, who was a Russian medical doctor. Gordon Wasson was a banker by trade, but Valentina, when he married Valentina and fell in love with her, well, probably the other way around, fell in love with her and married her, she was really loved mushrooms, when Gordon Wasson didn't know anything about mushrooms. But he became very, very fascinated, and together they researched the cultural uses of mushrooms around the world, many historical records, and then eventually went down to southern Mexico to experience the visionary mushrooms firsthand. And here is Maria Sabina herself, again a Christian mystic and shaman, burning copal in preparation for the mushroom ceremony. Here is Maria Sabina giving Gordon Wasson the first dose of psilocybin mushroom. This is in about 1953, I believe. Here's Gordon Lawson eating the mushrooms. Here is Maria Sabina during the ceremony, and Maria Sabina and her young son. Here's her older son, who was under the influence of the psilocybin, and he was her apprentice, and he's seeing visions at the current time, as you can probably tell. She was her ritual and her songs were part of her shamanistic practices, burning copal and singing, and she had beautiful prayers and songs that she channeled after imbibing psilocybin mushrooms or swallowing psilocybin mushrooms. Something like, because I can swim in the immense, because I can swim in all forms, because I am the launch woman, because I am the sacred opossum, because I am the Lord opossum, I am the woman book that is beneath the water, and on and on. She has very many beautiful songs that you can still hear today on the web. So search for Maria Sabina Veladas, V-E-L-A-D-A-S, Veladas, and you might be able to hear a recording of her singing and read some of her poetry. So here, moving on, here's a study that's more modern, 2005, one of the first studies on psilocybin after it was banned in the late 1970s. And it was sponsored by the Netherlands government, where psilocybin was actually legal, considered soft drugs. And they studied a lot of different people after their experience using psilocybin mushrooms and concluded that the physical and psychological dependence potential of psilocybin was the lowest of all drugs. The toxicity was low to moderate, and public health impacts and criminal aspects were negligible. They noted that concomitant alcohol use as well as other drugs increased the risk of side effects. And they found that after surveying all these different people, that the temporary mild to moderate increase in heart rate and breathing rate was often described and reported by people who had taken large amounts of psilocybin. Anxiety, dizziness, and nausea in over 25% of the users polled, especially with higher doses of over 15 milligrams of psilocybin, was reported. However, this was typically fairly mild and passed on after, again, maybe an hour or hour and a half, and not so much noted with lower doses. Here are the contraindications noted: psychological imbalances that are already present, like depression and anxiety, suicidal thoughts, pre-existing medical conditions with the use of pharmaceutical drugs, like bipolar disease and psychosis and so forth, pre-existing heart conditions, concomitant use of alcohol, especially heavy use, and MAO inhibitors, which are monoamine oxidase inhibitors that are maybe sometimes used to be used for antidepressants, not so much today. Now keep in mind that one of the primary ways to reduce side effects and to enhance the beneficial effect of psilocybin is set and setting. Set is short for mindset, whether you're depressed or anxious at the time you are taking them, and setting is where you're taking them. So, they're not really a party drug per se. I know some people use them as party drugs, but typically you're much more likely to get into trouble, like with anxiety and panic or something like that, if you're out in public, noisy, a lot of people around, taking higher doses. It's much more likely. So the mindset is usually best, that works best, is a calm feeling. You prepare yourself and maybe meditate. You're feeling mentally balanced and emotionally balanced somewhat. And you're taking them out in the woods or in nature is really preferable, or in a controlled environment where you have music and beautiful things around, maybe in your own home, your own bedroom. and driving and operating machinery is obviously not recommended. The important point too is that it's very important to have a guide, someone who can sit with you. It's wonderful if you have depression or anxiety or pre-existing conditions, like especially things like suicidal thoughts or severe anxiety, psychosis, things like that. It's really recommended that you work with a guide, with an experienced psychologist or psychiatrist who also is a guide for using psilocybin or LSD. Here are the medical benefits that have been noted. There have been over 1,000 clinical papers published on classical psychedelics, collectively involving 40,000 patients between 1950 and the mid-1960s. So there were a lot of smaller studies. Many of these are not well controlled or didn't have the greatest methodology. The most compelling evidence supported benefits of these studies reported or supported benefits for end-of-life existential pain in cancer patients and addiction. Now later, after these studies were really going and serious researchers were looking into psychedelics as potential medicines for depression, anxiety, existential pain of cancer, and so forth, that there was a media circus that really exploded after the report in Life magazine. And so many hippies went down to Maria Sabina's hut. Later, she actually said that she was sorry that she ever invited them to participate in the ceremonies, because so many people came down to their little village. It was totally disruptive. And later, the villagers became angry at Maria Sabina for bringing all these people down there and for, basically letting out the traditional uses of psilocybin mushrooms. So she had a really tough time later in her life over all this. Yet practitioners of psilocybin and LSD therapy remained underground. So even when the licenses were pulled and it became a Schedule I substance, there were still psychologists and guides that were underground that were offering some sessions with psilocybin and LSD, especially for alcohol addiction and other things that we've mentioned. My own dad was, when he was in his 40s and I was a teenager, then interestingly, he had some problems with alcohol. He wasn't maybe necessarily a frank alcoholic, but he was really dependent on drinking it every day. And he left my mother early on because she had alcohol problems too, and I'm sure there were other problems that I didn't know about. But then he remarried a woman that he was with the rest of his life, my stepmom, and she was a psychologist, and she was very interested in LSD therapy for alcohol dependence and alcoholism. And so she gave my dad a number of sessions, and it completely cured his alcoholism or his alcohol dependence, so that he never really drank after that. He maybe drank now and then, but it was never a problem the rest of his life. So that is, I guess, what got me interested in the first place in the therapeutic uses of psilocybin mushrooms and LSD. And of course, in the 60s and 70s, we were using them and collecting psychedelic mushrooms and finding out firsthand what they were like. And again, Michael Pollan's How to Change Your Mind has really opened up, along with just the natural changes that are happening in our society, and interest in psychedelic substances for healing has really, really taken off recently. Clinics that did have practitioners that were offering psychedelic journeys for healing required pre-screening of patients and emphasized the importance of set and setting, and incorporated things like music and smells and sounds like bells and other environmental stimuli along with the psychedelic treatment. And so this is actually expanded now, but it was going on ever since probably since the 50s and 60s underground. Other substances are used, such as peyote and toad exudate, which is also psychedelic, DMT, Special K it's called, which is ketamine, and now ayahuasca is very, very popular. And I know in the Bay Area there are a number of people that have come up, traditional shamans who have come up from Peru and other places in Amazon that offer ayahuasca ceremony. So boy, things are really changing. So here are some therapeutic benefits that can be found in clinical studies. Cancer-related psychiatric distress, like depression and anxiety. Here's a study, Grobe et al., 2011. Now, if you want to access these studies that I cite, it's very easy. You just go to Google Scholar and you type in Grobe 2011 and then depression or psilocybin, and the study will come up. In many cases, you can get full text articles and read the whole article, but at the very least, you'll get a summary of the study and what they discovered. So here are some details. I'm not going to go into all the details. If you want to know more, then you can access this presentation and just stop the presentation and read some of the studies in more detail. But the bottom line in these studies found that a presence of a mystical type experience and a high dose was associated with better outcomes for depression and anxiety. And they did find that after 6 months of follow-up, the high dose regime resulted in numerous improved clinical outcomes in 80% of the patients and complete remission in 60%. Now, there are no other known medications that can offer that kind of efficacy and treatment success. So this is pretty amazing, and I think that's why psilocybin and LSD therapy have garnered so much interest recently, and research interest and studies. Here's another one, Ross et al., 2016, that had similar results, no major side effects. So here's a small study, 12 people, 10 milligrams oral the first session and 25 milligrams the second session. That's a high dose. Every individual participant showed reduction in depression severity at 1 week that was sustained in the majority of people for 3 months. 5 of 12 were in remission at the final 3-month follow-up. And psilocybin did not cause any unexpected or serious adverse events. And here's the study, Cathcart-Harris, 2016. This is one of the first studies that on depression, and especially treatment-resistant depression. Remember, this success with these people were in people who could not be helped by other standard medications. For smoking cessation, here's an open label study, 15 people, 6-month follow-up. Moderate and high dose of psilocybin with a structured 15-week smoking cessation treatment protocol, they found that 12 of 15 participants, 80%, showed 7-day abstinence or 7-day point prevalence abstinence at 6-month follow-up. In other words, success, people that could stop smoking, and after 6 months they had still not started smoking again. So that is pretty phenomenal, 80% success rate for people trying to get off of nicotine addiction. And standard treatment, the best standard treatment, can only boast about 35% success. So this is really, really promising. We need larger studies, however. Now the topic of microdosing. Here's a person, Dennis van der Meiden, I guess you'd pronounce it, isn't aiming to see the face of God or embark on a sacred journey. And he's been microdosing psilocybin for 3 years. And you can read a lot more about people who are microdosing and their experiences on Reddit. So you can go on Reddit and just type in psilocybin or microdosing, and you can get a lot of people's experiences that they've written down and shared about microdosing. It's getting to be very popular in Silicon Valley. It's known as a productivity hack, perhaps. It may sharpen the senses and increase consciousness or creativity. In this particular case, Dennis van der Meiden found that that he didn't exceed 0.4 grams, 400 milligrams, because 500 milligrams made him a bit too joyful and a bit too philosophical. So he wanted a small dose that you take every day for an extended period of time, different amounts of time, where you don't feel at all stoned or incapacitated. You're not seeing colored visions with your eyes closed. You're able to function completely well, and you feel still lucid, and yet it does enhance creativity, enhance energy perhaps, help with addiction, and so forth. So this is quite a movement now that you can explore again on Reddit. So let's talk about the genus Psilocybe and some of the characteristics of psilocybe in here. Now here are a couple of psilocybe mushrooms. They're fairly small in this case. They're wild ones probably. And you're noticing some characteristics about these. First of all, they are small to medium saprophytic fungi, which means they live on decaying leaf litter and decaying wood pieces of twigs and things, biomatter in the forest, or sometimes out in pastures where there is dung around, where there's nitrogen and dung, maybe in some cases on the dung, like Psilocybe cubensis, and in some cases not on dung, but only near the dung where it's been well rotted and well composted into rotting grass or sedge or things like that. So you can find it in pastures or sometimes in the woods or sometimes in bark chips. Now, another very common characteristic of psilocybe is that it has a bluing reaction. So you're seeing when you handle it or you bruise it, then it's going to turn blue, is what you're seeing here. Somebody grabbed it by the stem here and here, and it's turning blue. Also at the base, you'll see blueness. So you see the blue here. Here's the mycelium, a mat of the mycelium at the bottom, but this is turning blue here. That means that it's expressing psilocybin and psilocin. Now another thing that you're noticing is that the spores and the spore print is purple or purple gray or maybe sometimes purple brown. Here you're seeing the purple coloration of the gills, which are producing purple spores on the face of the gills here for reproduction. Another thing you'll notice is that the gills where the spores are produced are various lengths. So you're seeing really short ones, you're seeing longer ones, you're seeing middle-sized ones, and you're seeing long ones. So the gills are of various lengths. In many species or genera, the gills are all the same length. Another thing you're seeing here is that the gills are not directly attached to the stem. You see here that they only go so far, and then they attach more to the cap here. So that's another thing that you're noting there. Now let's go on. Here is Psilocybe semilanciata, which is the one that we picked on the Oregon coast. It's very common in grassy pastures where cows are grazing or elk or other animals that deposit the nitrogen and then that compost into the grass, and the grass is also starting to rot, and then you'll get these psilocybin mushrooms growing in clusters sometimes. And when they dry out, you're noticing at first they're kind of viscid and brown and striated here with these lines, and then later they turn kind of lemon yellow. But they have a nipple. You notice the nipple on the top here? That's another feature of psilocybin. Not all of them, but some of them, is this little nipple on the top. So here is the purple spore print. You take the cap and you place it on a white blotter paper or a white piece of paper, and then you wait a few hours, maybe cover it with a glass or something, and then maybe even overnight you have to wait, but you will get a spore print. The mushroom dumps the spores, and then you're getting this beautiful spore print. In this case, it's purple, and that's a good sign for psilocybin. Here it is kind of dried out in a grassy pasture. Fruiting is sometimes massive, sometimes not at all some years. Psilocybe semilanceolata is one of the most common species in Europe and in North America. Here is the pellicle. It's a stretchy pellicle that is a covering to the top of the mushroom. Can you see it here? And you should be able to grab that and stretch it up so that you can see that it is elastic. It's stretchy and it's covering the top. And it's probably waterproof, but it can dry out, and then you get this yellow coloration of the top of the mushroom that we saw before. So look for this stretchy pellicle too. So what I want to say about identifying mushrooms, I talked about 4 or 5 of the major identifying features of psilocybin mushroom. Never use one characteristic. Always try to use a combination of characters to identify a mushroom. And that's any fungi, not just psilocybin. So in this case, we have a stretchy pellicle, we have a purple spore print, we have uneven gills, we have the gills that are not attached directly to the stem, we have a bluing reaction, and we have a little nipple on the top of many of them. So there are 6 potential characteristics that you can look for. Always try to identify at least 3 or 4 of these characteristics, and then you can say this is likely a psilocybin. And I'm not recommending it, remember, I would be liable for that, so I'm not going to recommend it if you happen to have a bad trip. But on the other hand, I'm just trying to give you information so that if you do decide to go out and pick them, then you can choose the right one so that you don't pick a toxic species by mistake. So even though I'm not necessarily recommending that you go out and pick them, if you decide to, then I want you to make a correct identification by using a combination of characters, and at least 3 or 4, never just one. And in that way, you're much more likely to get the right genus, Psilocybe. Also, the first time that you eat a mushroom, even that counts for edible or psychedelic, the first time that you decide to eat one, you're going to just eat a little tiny bit the first night, the first evening, the first day, and you're going to check for sensitivity. So what I would do was to eat just a piece of the mushroom the size of, say, a quarter, or even in the case of psilocybin, in the size of the dime, so maybe a half of one of these small fruiting bodies, or a whole fruiting body, and of the small ones, not a bigger one. And then wait and see how it goes. And then if that was all very well and no problems the next day, then if you decide to eat more, you could work your way up to a stronger dose. So always just ease into it. check for individual sensitivity, allergic reaction, and so forth. Now here's another species, Psilocybe cyanescens, which is very common in wood chips and beauty bark. I found some last year around a swimming pool in a retreat center. We went out there and there were all these Psilocybe cyanescens coming up in the bark chips. So that was pretty exciting to find so many of them coming up. And you can see here, wow, this is quite the fruiting here, very large fruiting of Psilocybe cyanescens, which is a very potent species. Note that the cap is often wavy when it is mature. And again, it has a purple spore print here that you're seeing. Here's Psilocybe azurescens, arguably the most potent of all species. Here you're seeing some bluing on the top of the cap without any disturbance, presumably. Again, this kind of amber, dark amber brown or light amber brown or light amber colored. The caps are wavy and upturned once they get older, and likely some bluing reaction. You can see that the gills are of various lengths here. So that's another thing. This is the most potent species, up to perhaps over 2% of all the, if you want to combine all the actives together. Here are a few other active species on the Pacific coast of the U.S. Psilocybe stuntzii, coprophylla, which is not active. I've seen that in Santa Cruz where I lived, but those don't hardly have any psilocybin in them. And a few others. Again, you can get Paul Stamets's book to see all the different species that are around. Now again, I mentioned that there are other genera of mushrooms that also contain psilocybin, such as Inocybe, now, and which are very common out there in the woods. Unfortunately, Inocybe usually contains, only a few species contain psilocybin and psilocin. Musk many of them contain a compound called Musk Green, which is really quite toxic. And I'll talk about, so Musk Green, you want to be very careful with this genus, Inocybe. Here is Inocybe corydalina, variety corydalina, found in California, and reports on this species are conflicting. Some say that it contains low amounts of psilocybin, but it also contains muscarine. So you have to be extremely careful. The difference between psilocybe is that they have a brown spore print, you can see here. No purple coloring. There actually is some bluing reaction here, though, on the top, which may indicate psilocybin content. And the odor is characteristic, kind of like green corn or something like that. If you crush green corn, it kind of smells like that. Very pungent smell. Over 60 species in California, so you have to be very careful with these. And I don't really recommend eating them as a, to try to get psilocybin, or psilocybin, because of this potential toxicity. So, but anyway, for your knowledge, this is a species within a genus, Inocybe, that does contain some, depending on where it's growing, maybe in Europe or North America. Now, I mentioned muscarine. Muscarine is found in the genus Inocybe, and also the genus Canocybe, and also in the genus Amanita. It's an alkaloid. It's a strong parasympathomimetic nervous system stimulant. The symptoms are, if you eat it, are sweating, tearing, slowed heartbeat, blurred vision, vomiting, possibly abdominal pain within 2 hours. It occurs in these genera again, including Entoloma, Omphalodus, Inocybe, Clitocybe. So any of these genera, it's better to leave them alone unless there are maybe a few edibles scattered among these genera, but it's better to leave them alone, especially when you're just starting out. You don't want to take any chances. So get to know these groups, and also I'm very often saying to beginning mushroom hunters not to take chances and learn the lethal ones. There are only a few lethal mushrooms out there, like Amanita phalloides, Gyrometra, Gallorina, so and some small Lepiotis. So you have to learn the handful of lethal ones first, and then you get to know those characteristics so that you can avoid them. And if there's any doubt at all, then obviously if there's any doubt, throw it out. And there's another saying that we have: there are old mushroom hunters and bold mushroom hunters, but there are no old, bold mushroom hunters, because eventually you're going to run into a very toxic species, possibly, if you don't know what you're doing or you don't pay attention. Here's another common look-alike, and this is Gallorina marginalis. This one, to me, doesn't look a whole lot like psilocybin, but it is a small mushroom. It's got a dome-shaped cap. It's got irregularly gills that are of different lengths. They grow in clusters on wood, but these are lethal. So you want to, anything growing on wood are not psilocybe. So you want to make sure if they're growing on wood to leave them alone. If they have a brown spore print, in general, leave them alone. Yes, there are edible species out there in different genera that, like even, which one can I point to? I can point to Cortinarius, which many of those have rusty brown spores. There are a few edibles. But on the other hand, when you're starting out, it's not worth it. You're better off if the mushroom has a brown spore print, whether it be rusty brown, chocolate brown, whatever, it's best to leave it alone unless you know exactly what you're picking. If it has a purple spore print, then it isn't necessarily always going to be psilocybe, because Stropharia also has a purple spore print. But many Stropharia in the genus, species in the genus Stropharia, they're not super toxic. There may be a toxic member in there or two that are not recommended to eat, but and some of the Stropharia look a lot like psilocybe, so be careful to really learn what the members of the genus Stropharia look like. But if they grow on wood, then leave them alone. Okay, leaving psilocybin for now, let's talk about Amanita muscaria with a fly agaric. Here I am holding a beautiful Amanita muscaria from the woods. Grows on all continents except Antarctica. It has considerable chemical variability, depending on whether it grows in Siberia or North America or some other place. So there is a lot of chemical variability, so you have to be careful with this one for that reason alone. There are other reasons to be careful with it. It's mycorrhizal with conifers. In other words, it shares nutrients with trees, a number of different tree species. In this case, typically conifers. So mycorrhizal with conifers. It attaches to conifer roots and rootlets, and they share nutrients. Very common among fungi. Sometimes there are massive fruitings in early winter to midwinter. And it's associated with the Santa Claus legend. However, it likely is not the origin, has nothing to do with the origin of the Santa Claus legend. And also, Gordon Lawson hypothesized and wrote a book about Amanita muscaria was really the ancient soma of the Vedas, of the ancient medical sect or spiritual sect. Some amanitas, though, remember, are lethal, so you have to be very careful with this species. Here's the book I mentioned, Soma, Divine Mushroom of Immortality, a good read. Beautiful mushroom, fantastically beautiful mushroom that you always are awe-inspired by out in the woods when you run across a fruiting of them. And it's the mushroom that Lewis Carroll wrote about the caterpillar sitting on, that one side makes you grow bigger and one side makes you grow smaller in Alice in Wonderland. And indeed, it just might if you eat enough of it. The Amanita characteristics: they have white gills that don't turn dark when it gets old. Maybe they get a little yellowed and maybe sorted yellow. The spore print will be white. You notice here that the gills are all the same length and very even. It has a universal veil of tissue that wraps around the whole mushroom. Forms patches when the mushroom fruiting body opens up. It forms all these patches here. I'll show you a picture of the whole universal veil in a minute. And it might have a ring on the stem or stipe like this. Also has a vulva, a cup at the bottom of tissue. Okay, here's the universal veil right here. See that the cottony tissue that covers the whole mushroom until it opens up, and then it starts breaking this universal tissue apart. In this case, this is the Caesar mushroom of Europe, very beautiful mushroom that's edible. Doesn't lead to spots of tissue being deposited on the cap, but there's still the ring on the stipe and the vulval cup at the bottom. Here is a grisette, which is also edible. This doesn't have a ring. This is, again, an amanita, but it has a big cup at the bottom, but no tissue sticks to the cap, and it doesn't produce a ring either. These are also edible, but again, you have to be careful. Here is the mushroom that causes the most deaths worldwide from mushroom poisoning, and this is Amanita phalloides. And this is very common in some areas, in California and in Europe and other places. Note the sorted green coloration and the vulval cup at the bottom. This is one that you strictly want to leave alone. The tops of amanitas vary quite a bit. Here is Amanita calyptoderma that has a calyptoderma means skin head. So you can see the skin sticking to the top as part of the universal veil. Here's a scurfy kind of top. Here is a smooth top, Amanita phalloides, and here is the Amanita muscaria, which has these broken up spots on the top because the cap is very sticky. Here is Amanita phalloides again. Here's another scurfy kind of Amanita with a big bulbous base like this, and the cup, instead of being loose, is attached to the bottom of the stem. Same here, this is attached to the bottom of the stem, but here is the ring, and here's the ring here. This is kind of like a skirt, and here's a ring here. And this base is also attached to the bottom of the stem and rather bulbous. Now this is the very beginning here of when they're coming out of the ground. The universal veil covers the whole mushroom, and if you cut it in half, you'd see that there's a mushroom inside. So any puffball that you want to eat, it's best to cut it in half first. This looks like a puffball, which many puffballs are edible, but this one turns out to be an actual mushroom. So you do not want to eat an Amanita button that you think is a puffball. Here's a Amanita caesarea popping out of the universal veil, and here they are here. You can see the universal veil covering, and then as they start to expand, then they come out and part the veil and so forth there. Here is Amanita phalloides again, the most likely mushroom to die from mushroom poisoning. Every year people in California are poisoned by them typically, or frequently anyway. And it's from people who come from other cultures, mainly Asia, who see this and it looks like a mushroom that they eat back home. So they cook a big pot of them up and end up being very sick. Amanita contains toxins that bind to the liver cells, the hepatocytes, and end up destroying the liver eventually, and that's how death occurs. Fortunately, there is an antidote, and that's milk thistle seed extract. So the seed coating, and only the seed coating, contain flavonolignans. It's a combination between a lignin and a phenolic compound, flavonoid-like compound, and they're very concentrated in the seed shell. So if you extract the seed shell and make a tincture, you can get the silymarin, is what it's called, the whole combination of several closely related compounds. The silymarin is available out there in the marketplace. You can buy capsules and tablets that are standardized to 85% silymarin. Unfortunately, silymarin is very poorly absorbed, so you always want to get it in a form that is bioenhanced, and that means that the silymarin is associated or compounded with a phospholipid called phosphatidylcholine, which increases the absorption of silymarin and also prevents the liver to a certain extent from breaking it down. So you can get the blood levels up higher with, if you get a bioenhanced one, with either black pepper extract or with phosphatidylcholine. And you can also make a tincture, but the tincture works fine just as maybe as a daily supplement, a dietary supplement, but for serious conditions like hepatitis or cirrhosis or mushroom poisoning, you've got to really get that dose up, and you'd be taking at least 3 or 4 grams of the commercial capsules or tablets that are standardized to 85% silymarin to really have any effect. Now, in Europe, it is approved to use IV, intravenous doses of silymarin, and they have reduced the death rate to 0 in Europe just simply using the intravenous silymarin dose and also threading a catheter into the gallbladder and sucking the bile out, because the active poisons, toxins from Amanita phalloides concentrate in the enterohepatocirculation. That means that once we swallow it, it's absorbed, goes to the liver for detoxification, but the liver cannot completely detoxify it. Some of the liver cells are harmed, but some of it is excreted out of the liver into the bile, into the gallbladder, and then unfortunately the body can reabsorb that, and the concentrated toxins, which are Amanita toxins, and then it gets even worse. So it goes around and around through the liver, more and more concentrated, and that can destroy the liver eventually or harm it irreparably, where you'd need a liver transplant. So with those two methods, sucking out the bile and sucking out the toxins, along with intravenous silymarin, they have been able to reduce the death rate to 0 if you get in time. The range of Amanita muscaria, you can see that grows all around the northern hemisphere typically. Now, fly agaric and the Santa Claus legend. I always liked this idea that because Santa Claus had a red suit with white trimming, he went ho ho ho, the reindeers are flying, that somehow it was associated with Amanita muscaria. And so Santa, some people say Santa was a shaman up in the Arctic, and that's where the Santa Claus legend originated. From what I've seen from my research, the Santa Claus legend really started with St. Nicholas, and then later was migrated into Germany and began to expand and grow as a ritual. The tree and the presents and so forth slowly developed in Germany and then spread to other parts of Europe. But here is a picture that I found of an old postcard that shows Santa with an Amanita muscaria button in his toy bag. So I thought that was very interesting. Where did this come from? This was a postcard, so a Christmas card, so I have no idea where it came from or who got the idea. But anyway, it's an interesting idea, but apparently not closely related. Still, you see lots of Amanita muscarias associated with Christmas. I even bought an ornament when I was in Kiev for a mushroom conference years ago. I was in a outdoor market and they had Christmas tree ornaments in the shape of Amanita muscaria that had dots all over it, and I thought that was beautiful, so I bought a couple of them. But here you're seeing a Merry Christmas and Happy New Year with an Amanita muscaria, and here, so it has been associated for some reason. Here's a Christmas tree with Amanita muscaria ornaments. This is why reindeers fly. They eat Amanita muscaria. Here's more. Here's a booklet when Santa was a shaman. And here's an early picture of Santa. Here is a Amanita muscaria shaman from Siberia that's doing a ritual, performing a ritual. Now, Amanita muscaria shamanistic use. In Siberia, it was first written about in 1738 by Strahlenberg. And I'll quote this, those who are rich among them lay up large provisions of fly-agaric mushrooms for the winter. When they make a feast, they pour water upon some of the mushrooms and boil them. They drink the liquor which intoxicates them. The poor, who cannot afford to lay in a store of these mushrooms, post themselves on these occasions around the huts of the rich to catch the water, holding a wooden bowl to catch the urine, which they drink greedily. So this is a very famous story about Amanita muscaria that people were seen, the poor people were seen around the huts of the rich, in the dark, trying to catch the urine, because the hallucinogenic compounds, ibotenic acid, muscimol, tend to concentrate in the urine. So then they could drink the urine and they could become inebriated as well. Here's another quote from 1874. They eat certain fungi in the shape of fly-agarics, and thus they get drunk worse than on vodka. To them, the very best banquet. Here is a shaman from the north in Siberia. Sometimes the Amanita is mixed with fireweed, which is here you're seeing, which is Epilobium angustifolium. This grows in North America as well. Apparently it improved the flavor, or maybe it had or counteracted some side effects. I don't know why it was used, but apparently it was rolled with the dried fireweed, Epilobium angustifolium, and swallowed whole. Now here are the symptoms of drunkenness that you might experience after you eat Amanita muscaria. The dose is typically one small cap. Usually the skin is peeled off because a lot of the active ingredients are some of the toxic ingredients like Musk Green, there's a little bit of Musk Green, occur under the skin. So sometimes they're peeled. You can make a tea, again, you can boil it. The active compounds, again, ibotenic acid, is water soluble, so it will come into the tea, and you can drink the tea and become inebriated from it. If you drink enough, you can have hallucinations and visual and spatial distortions and so forth. Shaking, so you get shaking of the extremities, maybe if you eat enough of it after 30 to 60 minutes, hallucinations. The visions are terrifying or felicitous, depending on temperament. Some jump, some dance, others cry. However, these extreme symptoms are usually when you eat a lot of them. So eating a small fruiting body is not going to likely do that. or a medium fruiting body. You have to eat maybe several fruiting bodies to have that happen. Those that take a small quantity experience a feeling of extraordinary lightness, joy, courage, and a sense of energetic well-being. Well, certainly that sounds good, doesn't it? And I happen to know from other writings that many common people will eat Amanita muscaria from the woods if they find them, but only very small doses. So they're basically microdosing Amanita muscaria. They use them recreationally, and they use them for working hard. It gives them energy, and the cap contains more of the active ingredients, muscimol and ibotenic acid, than in the stems. Here is the sequence of events after you ingest them. After a half an hour, you're starting to feel visual and auditive aesthesia. In other words, you're feeling funny. You're starting to have spatial distortions of space and time. You're feeling tearing up, and then eventually, after a few hours, maybe you feel tired and drowsy, and you fall into a deep sleep, and you have vivid dreams, and then you recover after about 6 to 8 hours. Here's the chemistry. Here are the two active compounds that we think are the active ingredients, ibotenic acid and muscimol, which are very closely related. Thought to be the main active ingredients. The red skin and yellow tissue underneath is the most potent when the whole cap is used. Sometimes they're peeled if you want to make them less potent. Have effect on the central nervous system, cross the blood-brain barrier, act like GABA and glutamic acid neurotransmitters, and similar manifestation to alcohol intoxication, only with hallucinations if you have enough of them. The first manifestations again appear after about 30 minutes to 2 hours after consumption. You might feel dizzy, difficulty in balance and movement and coordination, as well as tiredness that sometimes progresses into sleep, followed by psychomotor excitement with euphoria or depression and anxiety, visual and auditory hallucinations. The phases of tiredness and excitement may alternate several times. Increase in body temperature, the skin and mucous membranes become dry, face might be red, and the pupils dilated. Now, here is another species of Amanita that kind of looks like Amanita muscaria. It has the dots, but you're noting that it's kind of amber brown. This is likely Amanita pantherina, and this contains a lot of the muscarinic acid, muscarine. So you don't want to mess with this one. This one is considered toxic. And so again, if they're bright red or even bright red with a little orange in it, then they're more likely going to be Amanita muscaria. But you want to be careful and eat just a little bit the first time always. Again, I'm not recommending it, but if you choose to eat some, always start out low and work your way up. And always make sure to leave any ones with brown highlights in them, or if they're just brown like these, leave those alone, or any of the other amanitas until you know exactly what you're doing and eating. Now they're called fly agaric because they put them, it's traditional to put pieces of the mushroom in a little liquid and let them ferment. It creates a yellow liquid like you're seeing here. And flies, and it smells rotting, it smells fishy. If you've ever smelled a rotting mushroom, but especially rotting Amanita muscaria, they smell very fishy, and so the flies come to lay their eggs, and they fall into the liquid, and they become stupefied, and then they end up drowning. So here in Slovenia, there was a study that showed that it actually did work. Added to milk, it releases ibotenic acid, flies become intoxicated, and maybe drowned and end up dying. They're also edible if you parboil them first. So here's a great read about the history of cultural uses of Amanita muscaria as food, Rubel and Aurora, 2008. So you cut the mushroom up like this, you leach it out by boiling it, They're parboiled, sometimes 1 to 2 times. They're parboiled for 5-10 minutes. Then the liquid is poured off. That will get rid of all the active compounds and just leave the proteins and carbohydrates and so forth. So they're leached basically. And then after the leaching, they're stir-fried in butter or olive oil, and then they're actually quite delicious. So I've eaten them. They were really tender and good texture and very tasty, but make sure to leach them first, then stir-fry them. No publications can be found that actually report death from Amanita muscaria, according to these authors, Rubel and Aurora. Here it is, slice the cap, parboil for 5 to 10 minutes, drain. You can do it a second time if you really want to be safe. And then you stir fry them with garlic or ginger and olive oil or some other oil, season with garlic, ginger. Try 1 to 2 slices the first time. Here they are that have been leached and stir fried here as well. You usually find a lot of sporocarps, in other words, fruiting bodies, out there in the woods in the fall. So they are delicious after they've been leached and stir-fried. It's a most interesting fungi, that's for sure. So reishi, the divine mushroom, I'm not going to go into that presently. That will be in the next talk, but in this talk we've covered psilocybin and we've covered Amanita muscaria. Hope you enjoyed the talk, and I'll see you next time.